Absolutely. So SumeetSSG is focused on upbringing the standards of emergency medical care in Maharashtra. We are willing to set the example not only in India but for the world. In order to do that, we are not only bringing a complete new fleet of vehicles, including advanced life support ambulances, basic life support ambulances, neonatal ambulances, first responder bike ambulances, and even boat ambulances. But we are also focusing on equipping our fleet with the best possible medical equipment and devices based on international standards, and also on the upskilling of the healthcare personnel, doctors, paramedics, nurses and pilots that will be working with us to save the lives of the citizens of Maharashtra.
And could you tell us a little bit about the technical specifications of, say, the ambulance as well as the bike ambulance? Because I think the bike ambulance is something relatively a newer concept here.
Yes, the bike ambulance is our first responder bike ambulance. In emergency medical services, there are many conditions which are critical and which are time dependent, like a stroke or a cardiac arrest. And especially in India, we have lots of traffic concerns, especially in urban areas. So when these emergencies might occur, we are dispatching the first responder bike as fast as possible, together with the advanced life support. Advanced life support, bigger, heavier vehicle will take more time to arrive. So our first responder bike will ensure that we get to the patient as quickly as possible, and we start providing care. One of the main things that we want to change is the mindset. Our emergency medical service is not about bringing the patient to hospital. We are not a transport provider. We are a healthcare provider. So what we want to do is we want to bring the hospital to the patient. We are providing the utmost care since the moment we reach the patient, and even before that, because we are also managing an emergency response center to which all citizens of Maharashtra, obviously for free, can call. And whilst our vehicles are being dispatched, we are also providing them with an online, on-phone, on-call support, so that they can also feel reassured, comforted, and know how to aid the patient whilst we are getting there.
One last thing, could you tell us the number on which a patient could call?
Yes, 108.
Okay. Yeah. Thank you so much.
Tell us about this initiative and what do you want to say about why in Maharashtra for this initiative?
Go ahead. Sir, with all our intention, what we are bringing is to try to make the hospital getting close to the patient, not anymore taking the patient to the hospital. This is the main core and takeaway message that I want to convey to whoever who is attending to this information. The change of mentality of having a proper resource that is properly equipped with proper skills to make this feeling that the hospital now is in the patient. No need to bring the patient to the hospital facility. Thank you.
What all facility will be there in
This is going to be the most advanced. This is going to be the most advanced fleet of ambulances to be introduced in India. They will be fully functional with the best of the world-class medical devices, technology tools, as well as informative tools to operate the most effective emergency medical service in India.
And how many places you are trying to launch this?
This is a state project, so we will be working for the state of Maharashtra, but this will be a free-for-all, complete Maharashtra project. So this will be for the 1,756 ambulances that we are mandated to introduce in Maharashtra. These are categorized in 6 different versions: ALS, BLS, neonatal, river, sea ambulance, and also bike ambulances.
That's correct. What is how can they contact you? Like the contact.
It's a toll-free number. Either you have to dial 108 or 112, and you will be reaching out to our emergency response center, and you will be able to use these services free of cost for everyone.
And next, which state will be targeted?
We intend, we have our discussions ongoing with some good important key states of India. One of them is a South India state and the other one is a North Indian state. So we see that coming year we should be having one more project with us.
What do you think is the impact in
madam.
project,
Sure.
what is the impact of such a project in the near foreseeable future
Certainly.
where healthcare is concerned?
It is having the most high degree of social impact, madam, if you believe me. I don't see that any other project can have an immediate impact with the 140 million people of Maharashtra. And this is across all, all different parts of society. So, especially when people do not understand fully how an emergency medical service operates, I think this will be a complete eye opener for them. And when a patient would be able to use those sort of an facilities where an air conditioned patient compartment is taking them with the best of the medical equipment to a nearby hospital, if they are having any cardiac emergency, treating them with a ventilator, with a defibrillator, with an injection module system, with a digital oxygen delivery system, it's like life saving for them. I think people, in case of emergencies, the people who are related to them and the person who is suffering, everybody is just having a life-threatening situation. So coming to their assistance at that most important time, I think that's very noble for us.
For me, for me, madam, just to also reply for it, my most honest intention is also to bring light that emergency medical service is an industry that has to be also taken care, that has to be also understood, that has to be also developed here in India. And if with this project we are raising that awareness that can be replicated in another state, whether it's SumeetSSG or it's another one who matches the same quality standard, it will benefit the entire country, which is our main intention.
It is very reformative. So basically this will be a new benchmark which other people will have to also follow.
Thank you.